Good morning, everybody. Welcome to TAARE Social. Thank you for coming and joining us on a Saturday morning. Uh, we'd like to again invite Dr. Prem to have his talk on post-COVID care. I think an important topic. A lot of people have gone through COVID. A lot of people have had family members and loved ones having gone through this. Uh, uh, I would ask Doctor to actually have this conversation with us. Two, 3 points that we need to keep in mind. Number one, while the doctor is talking, I will be muting everybody. After he finishes, I will allow everybody to unmute. Please ask your question and mute yourself. Number one. Number two is in case any of you want to talk to the doctor or for a private consultation, reach out to me at TAARE Social and I will connect you to the doctor. And number three, we'll be recording this session so you can watch it again in case you need to. Also, other recordings of Dr. Prem's sessions have been there on our website. Without further ado, I'd hand it over to Dr. Prem.
Good morning, everybody. Uh, as everybody says, to be very frank, the issue might not be COVID only. The issue in the future will be when the dust settles, what all COVID has actually done, and what all issues that a person will have long term and also short term. So, today, of course, I'm going to talk about post COVID, which is immediately after you recover. There are some certain lingering symptoms which happen and which can be really sort of troublesome. So, what are these? To be very frank, one of the most important things that has irritated people in the post-COVID syndrome is, of course, cough. Now, to a great extent, cough tends to sort of just linger around. It can be highly irritating, and then obviously it will be that you will be able to sort of, it will just be very irritating, and the more you are obviously trying to sort of manage it, just not doing anything, the more difficult it will be. So it's always better that you actually get something for it. So it could be as simple as just cough suppressants and taking your hot water, things like that. I mean, those are very important, but it's an irritating sort of symptom, so it can linger on for a few months also. So, of course, if you're having cough with maybe even blood coming out or things like that, then you need to obviously take it more seriously. So that is one. Secondly, you might have something known as, of course, a severe sort of fatigue. Now, this fatigue can last, I mean, to be very frank, it's a viral illness, so it can last you even for months together. But usually, at least a month or a few weeks post COVID, you will have severe fatigue. So please make sure that you don't rush into whatever work you want to do. If you rush into it, you will get tired very soon, and then at the end of the day, you might just want to rest again. So even after if you're home isolated, even after those 14 days, do not jump into anything. Just give yourself maybe 7 to 10 days more to rejuvenate yourself, and then try to get into any kind of work. And by this, I even mean household work. Even household work can be really tedious for a person who actually has undergone COVID. So that is something you need to take into mind. Then, long term wise, to an extent, COVID also has issues with the kidney. So one has to make sure that you take good amount of water and don't take too much amount of painkillers. Take a good protein diet, because that will be the one which will help you in preserving your body and preserving your kidney. Now, one thing which is really sort of bothersome afterwards, and it has been the biggest issue, is the mental trauma and the mental anxiety that a person with post COVID undergoes. Now, purely, one is, of course, the fact that getting COVID itself can be really tiresome, because unfortunately you have to be isolated, because it's such a disease which spreads so easily. So you have to be isolated, you have to be alone. Getting isolated in your home itself is so difficult. So you can imagine people who have to be isolated in the quarantine centers, who are away from their home. So it takes a lot of mental sort of tension, stress. There has been seen people are suffering from insomnia, people are suffering from lack of sleep post COVID also, and this tends to linger on. Just people getting up with pure panic attacks of thinking that, oh my God, I had COVID. And then another unfortunate part which happened in the so-called second wave is also a lot of families got involved. I mean, if one person got, then four, five, six, a lot of people got. And unfortunately, not everybody made it. So who actually survived had something known as a survivor guilt also. That why the others didn't survive and I survived. So why did that happen? So that questioning of that I could not take care of the other person if I would have taken more precautions. So things like that, and that tends to linger. So anxiety is something which has to be taken care of post COVID because it's got a significant amount of uh, health hazard, purely because if your mental health is affected, then it will start affecting your physical health to a great extent. And in this, do not shy from taking away advice. Even if you have lost somebody through COVID, please try to just express yourself, whether it's to somebody you know, whether it's to a counselor, whether it's to a doctor, but don't keep it to yourself, because just accumulating grief can only increase the anxiety. Then another important thing which has happened is, which a lot of people are undergoing, is something known as just lack of concentration, just something known as a brain fog, just trying to do your routine things, trying to get back to work, but getting too confused. Things that you were able to do easily before, you're not able to do now. So that also happens as far as a post COVID sequel is. So you have to just give yourself time. Don't be too hard on yourself. Take a break, rest yourself completely, take good diet, sleep well, at least 8 to 10 hours, take plenty of water, juices, fresh vegetables, fruits, so that you can actually rejuvenate yourself and then try to do sort of things. So this can be really sort of harmful as far as post COVID is concerned. Now, what can you, of course, do about it? These are the things which can sort of happen. So in your recovery, six things you should definitely do. One is, of course, take your rest, get enough sleep. As I said, focus on healing rather than just hurrying into working or doing your work, whatever you want to do. Number one. Number two, have a really nutritious diet, because that will always help you. That will help you in gaining strength. Something which is rich in legumes, maybe lentil soup, seeds, nuts. Eggs are good if you eat eggs. If you're a non-vegetarian, then chicken stew should be nice. Proteins always help in repairing your body. They are the building blocks of your body. They and try to take proteins which are good for easy digestion. Don't forget to take fruits and vegetables daily, fresh fruits, and get yourself hydrated properly, at least 1 to 1.5 liters. More so, even now, it's only getting hotter. We might get into the rainy season very soon. So that also becomes really sort of, humidity will only increase. And as you get old, you might not necessarily feel thirsty, but you need to make sure that you take adequate amount of water. Then exercise a little every day. Now you will have fatigue, so at least try to exercise in a graded manner. By that I mean, maybe give yourself 10 minutes the day one, slowly, steadily, maybe do just 10 minutes, and then increase it as you go ahead, so that maybe you can reach your 20 or 30 minutes. But don't do too much on first day. If you get too weak, then there is a strong chance that you might not do anything again. Then try to play a few memory games which will only help you in improving your memory or whatever temporary loss you feel, whether it's Sudoku, whether it's puzzles. Try to listen to some music, try to meditate. All these things will only help in keeping your mind really fresh. And it's very, very important that and pertinent that you take care of your mind during this time. I'm emphasizing it because a lot of people have a huge amount of mental scars post COVID recovery. The fact, I mean, because once it hits them that they had COVID, getting out of those 14 days, then coming back to normalcy, so a lot of recovery issues happen. Now another thing is, don't overdo or underdo checking your vitals. I think that is very important, because everybody tries to check the saturation just too many times. There will be at some point of day a bit of fluctuation. It might not be life threatening, but if you feel symptoms like you are feeling very breathless, you are feeling uneasy, then see your saturation, blood pressure, everything, so that you obviously feel better after checking that. And if things are not okay, please consult your doctor, because that is another thing which is I think very, very important. Now, I'll just give you some examples that people have quoted in their experience as far as post COVID is concerned. Now, now a woman with long hair would love actually to take care of that hair. Now, it was very clear that people expressed that I am not even able to shampoo my hair, which was so easy to do earlier. And it is very normal. When trying to do that, people have actually have a bit of brain fog and fatigue. The fatigue is the one which is incapacitated. Knees feel really wobbly. They couldn't stand up also. That also happens because the body pain can be pretty severe and it can continue maybe for a few weeks more. Then awake at odd hours. Sleep pattern can get really disturbed in COVID. Getting up odd hours through panic, not trying to do anything, just trying to think about what went wrong or what's happening. The, the worst part about is recovery might not be linear. For example, if you're doing okay, you're fine, you think everything's okay, but suddenly you get cough, and then that cough can come, it can settle, maybe a headache can come, and then it can subside. So you have to make sure that you don't sort of feel that everything might be linear. Then they've also quoted as saying recovery is very much like the London weather. I mean, if the London weather is supposed to have different shades in a single day, it might rain one day, the same day it might be sunny. So you might feel very good in the morning, you're all bright, but as you go later, fatigue might set in, and you might think that it's just I feel so weak. Then headache in the period of recovery can be really, really severe. So avoid stressors, try to rest more and more. Then another important thing is a lot of times you can see it in a positive way or you can see it in a negative way because you're not in direct contact with people, of course, with phone, with social media, with WhatsApp. You might be able to, but how much of that will you be able to do? There's a lot of self talking that you might have to do when you actually have COVID or post COVID because you're isolated. So that can be very encouraging, and at the same time that can be discouraging because you feel that you're not around friends and family, you're not hearing them. Then another problem happens if you have COVID, which is very common, which has been very common, and your kin has it, they are admitted, you are at home, you are not able to go because you are having COVID. So things like that are the ones which really sort of hamper your mind, and that can really make that isolation period and feeling isolated really, really sort of stressful. Then whenever the fatigue comes, it can really like harbor you to a great extent. Then a lot of crying can happen purely because just getting out of this particular thing, maybe a survivor's guilt, things like that can really sort of affect you. Panic attacks, a lot of people have been suffering from panic attacks. Then earlier I could walk very easily, half an hour, 40 minutes. Now just 5 minutes of walking is making me weak. Yes, that can happen. So that also is something you shouldn't worry about. It's not that it's because you can't do it anymore. It's just you have to do it. Then earlier you could talk a lot to people, but now you are not able to talk continuously. It can happen post COVID purely because there's a lot of fatigue. So you will have to give yourself time. Then trying to look at messages, not understanding emails, not understanding what's actually happening, that can also happen. As I told you, a bit of brain fog. So you can wait up, you don't, your reactions might be slower. Then one very irritating thing which has happened to a lot of people is the sense of smell. Now once it goes in COVID, it might take long time to come back. So it's like people have quoted saying that I am not even able to get any smell. So it's just so bad. And imagine not able to smell anything. It becomes really, because smell can be an instigator for bad things, good things. Smell is how you actually feel hungry also to a great extent, because you smell something really good, and then that is when the hunger sets in. So without smell, uh, it can be really lingering. Then just having panic attacks and anger, you can have bouts of rage. Maybe it's a lot of emotional turmoil which you have been undergoing, and that can come out in bouts of rage. So just relax, just try to take your take a deep breath. Sometimes that really helps, because you can't really always think about the fact that why it happened. because it's very, very difficult. People have queries like, uh, I didn't even go out. Then why the hell did I? Why the hell did I get all this? So it's not necessary that you went out. Maybe somebody did. There was some kind of sort of issues, and that's what it became that way. So you just need to make sure that you don't dwell too much into the past. It's easier said than done, but try to be really sort of uh, relaxed and try to come out of it slowly. Give yourself time. Don't rush into getting out of anything, because that can be a real issue. So thanks a lot for your patient hearing. If at all you have any questions, I am ready to answer it. There is already one actually. uh, as far as black fungus is concerned, uh, in the chat box. I think black fungus is something which is not only related to COVID. Let me be very frank. A person who has got diabetes, who has got immunosuppression, who's already been in the ICU maybe for a long time, might end up getting the black fungus, who's on long term steroids. So it's not necessary that people only with COVID have it. Now the best way to actually improve yourself and make sure that you have a less chance of getting the black fungus is basically keep control of your diabetes. If you already have it, take care of your comorbidities, have a good diet, have a good sleep, keep yourself healthy. That's the best way of avoiding it. Make sure you take all the precautions against COVID so that you don't get COVID, because there is a chance of you getting black fungus when you get admitted and not when you're just moving around in the public, because it's not something which is found everywhere. So that is something which is very, very important. uh, I mean, and try to ask everybody rather than just sort of uh, just thinking. And it's basically mucormycosis. I wouldn't just keep thinking about black fungus. Try to make sure that if at all you have symptoms of the same, please contact your doctor, because that's the best way you can sort of tackling that. If you will just have blackish discoloration, maybe blackish discharge, nasal blockage, all those things will happen, but it's not very common. It's not something which is going to come if you are having a very normal life. It is more of uh, in people who actually who have been used with antifungal, whose immunity is heavily compromised. So those are the people who have a great chance of getting that. Then long term wise, as far as COVID is concerned, as far as supplements are concerned, I would say just take a good diet. I mean, only supplements never help. Take a good diet, sleep well, exercise, keep yourself fit. That's the best way. Supplements like vitamin C, vitamin B, I mean B12, then other B complexes, they might help you, but it's better to supplement them in diet and supplements both rather than only supplementing it. So yeah, if you have any questions, please.
Yes, doctor. Yes, doctor.
Yeah, please.
I'm because now COVID is going on. I'm taking barley water also along with my other water, and also I'm taking sabza in the water.
Okay.
Yeah, is it okay?
Yeah, until unless it doesn't do any harm, I have no issues.
Yeah, because even I'm also taking this what you call vitamin C, and what you call that Bicosals with iron, Bicosum, what it's called.
Yeah, I mean, taking supplements is all fine, but I think the still crux remains to take care of your medical conditions if you have any, and take a good diet,
Yeah.
and take plenty of water and exercise to the
Yeah,
maximum.
I do a lot of yoga in the morning, at
Yeah.
least 1.5 hour, 1 to 1.5 hour in the morning.
Because remember, the supplements are the ones which will not protect you. They only
Yes.
supplement. It's in the name.
Yeah.
It's a
Yes.
supplement. You have to make sure that your immunity is stronger through natural ways. That is by actually making sure that
And
you eat
steaming also, doctor. Steaming also.
steaming plus minus. If you don't have anything, I don't think you need to steam. Steaming
But-
will not protect you from COVID.
But when you come from down, at least you feel like taking the steaming, wash your hands, wash your face.
That's okay, but it's
To
not
be a little more
protective.
precautious, like.
It's not protective. It will not protect you from anything. It's only something which might make you feel good. It's not protective.
Okay. ठीक है.
Any other questions for the doctor?
Can you hear me?
Yeah, I can.
Yeah. Now, what is this white patches now, the latest that has started after the black fungus?
I mean, to be very frank, there is a white, there is a yellow, there is also an orange fungus. The orange fungus, of course, Baba Ramdev. So that's so that is something we don't talk much about. But as far as the so-called
That was
white
a good one.
uh, the the white fungus is concerned, it's basically, I mean, it's just something known as Bavaria bassania. That is what it is. It is not more serious than mucormycosis. It rarely causes a human fungus. So it's just that we have branded from the media that it's white fungus, it is black fungus. They have specific names. It's mucormycosis. It's not necessarily a fungus. It's actually belonging to a different class per se. But of course, you as laymen don't need to know those technical details because that will only make you more scared. So again, this is very rare in humans and it's only happening if your immunity is down. So try to focus on taking care of your health, and rather than thinking you might get the black fungus or the white fungus, it is best that you take care of your health, and that is the only way which is going to protect you from COVID or any other thing. So be in touch with your doctor if you have any issues. Take your precautions. Be patient. You have to realize that this is not going to go off very soon. There will be more challenges, and that's what is happening because the treatment last year, the variants changed. This time we have an added issue of actually the mucormycosis as well. And this is only happening because the burden on the health system increased so much that the number of cases went over the roof. And that is what something which would have never happened in the first place, purely because just because the world has a second wave doesn't mean we should have a second wave, but we couldn't prevent it. So we only have to be more smarter now. That is the only way that we can sort of prevent a so-called third wave. uh, so the best, see, the doctors are actually lesser than last year. We have lost at least 700 doctors, so that's not going to increase. What is going to what the only way this can be prevented is by spreading the spread of COVID, which is, I think, the responsibility not only of the healthcare worker, the government, but it is also a responsibility of the public to actually take all the precautions. And everything can wait. Let me be very frank. You might be at home for 18 months not going out, but it can wait. It is very simple. Jaan hai to jahan hai is the simple quote. You just wait out the period. Make sure you try to get your vaccination. Be smart in getting your vaccination. Your in and out time should not be much. uh, and of course, the shortage and all those governance has only created more confusion. So that is not something I'm going to go into it, because neither I nor you can do anything about it. But all I can do is, whenever you get a chance, get your vaccination. Vaccination does not make you immortal. So please continue to take your precautions. While going to the vaccination is when you really have to be careful. The reason being, that is when you're coming in contact with a lot of people. That has to be a minimum contact. Be 6 feet away. Wear your mask. Have your hand sanitizer with you also. Maybe even wear a shield. Wear a double mask if possible, and then get it done and get out of that. That is your only aim, is to go get the vaccination and out. Do not get excited or do not get into any kind of conversation just because you see people, even people you know after a long time. They will understand. Just do the vaccination and go back. I think that's the best way to sort of make sure that you're going to prolong things. Is any other question?
Doctor, while walking, when I'm wearing double mask and going, but sometimes I feel very uncomfortable, and I get scared putting it down because my one friend, he had just put little down and he got COVID and he died also. So he told me never put it down when you are going for a walk and all that.
No, you shouldn't. Take your breaks. You should not be continuously walking. You can take a break and walk. All I can say is doctors are wearing an N95 and a PP suit for 12 hours and they are saving patients. So if doctors can well do it, I think.
But because of the age and because of walking, doctor, you feel little, what do you call, I don't know. You feel a little irritated, like, you feel like taking out and breathe a little and again put it back fast.
Yeah, so you can take your breaks, but all I can say is the choice is between getting COVID and having a bit of irritation. So you have to take that choice.
Any other questions for the doctor? I think we have time
Thank
for
you.
one.
Yeah.
Thank you, doctor.
Thank you.
I
And
have
after
two
the
questions.
second dose, have you to take anything else?
No,
Hello? After the second dose?
not as of now.
Okay.
Maybe sometime in the future, if we have to take a booster dose, we will come to know about it.
I know that's what they said. Anyway.
Let's see. We have to wait and watch.
Okay. All right.
Doctor, I want to ask a question. After COVID recovery,
Yeah.
when do we take the next shot? I took the first shot. Within 15 days, I got to COVID. And after the recovery, how many days? Now, government has said 3 months or something.
Yeah,
After
and
recovery.
to be very frank, 3 months is the norm purely because the COVID app has been modified. So if you want to take it earlier, it will not happen.
Okay. So
But
3 months.
3 months is fine purely because not because you shouldn't take it, because your antibodies
Full
will be there. So it
Okay.
will protect you again, but that doesn't change anything. You still have to mask yourself. You are not infective to others, but reinfection is also common. Not very common, but it has been seen. So that makes sure that you don't slow down the precautions.
Another point you said about mental fog. I have experienced it not knowing. I had heard about rest of this thing, but this is the first time I'm hearing about the mental fog post-COVID. So I have been feeling it, which is unusual for me. So I wondered why is that? And what can we do specifically on that?
So you basically should just relax and try to meditate and get out of it. Why I'm saying is, see, what has happened is COVID unfortunately involves a lot of more issues. And let me be very frank, COVID is not the most dangerous disease on earth. It is not. It only spreads very quickly. It's killing people because of the way it spreads. The numbers are an issue, not the disease per se. That's why we want to control the numbers. But with it, a lot of things happen. For example, if you have cancer, cancer is going to kill you for sure at some point, although treatment has improved. Tuberculosis is there for ages. But what has happened now is, unfortunately, we are focusing only on COVID because there is a huge amount of mental issue also. You have to be isolated, you're not with your family, you're not in touch with people. And on those 14 days, a lot of mental issues might come up also. So you need to just make sure that you still keep your head in ways best you can, whether it's music, whether it's meditation, because everybody is like, there's so much to do online. I mean, you can keep yourself busy, but that doesn't work always. It's you in the room with your phone. In a hospital, sometimes those people don't even have phones. So all they are is just isolated, and whenever the phone call comes from home, and that is the only time they can talk, because we as doctors and sisters make our best efforts to actually meet them, talk to them. But then we are always going to be in PP suits, so they will never. We have our names, everything, but to be very frank, everybody seems very similar. Everybody seems like astronauts from outer space. That is the unfortunate part of COVID. But that's the thing, because it affects everything. If it was only affecting a physical part, then it was a different story, but it doesn't. So you have to slow down. You just keep yourself time. Don't make it known with 14 days are over. After that, I'm just going to go back, spring in my step. That's not going to happen. Give yourself at least 1 week, 10 days. After that also, just relax. Don't give yourself too hard tasks, mental tasks also. Just relax and slowly get out of it. So you should give yourself time. I think that is the best advice I can give you.
Thank you. Thank you very much.
Thank you very much, doctor. I think we are
Thank you, doctor. All the best
Thank
to you.
you.
Thank you.
Thanks for what you're doing
Thank
to society.
you.
Thank you,
God
doctor,
bless.
for giving your
God
precious
bless
time
you.
to us.
I'd specifically like to
Thank
thank
you.
medical
Thank you
guests
very much.
who basically have been, fighting this virus tirelessly for the last 1 year. To all the doctors, to all the nurses, to all the ward boys, to all the administrative staff of the hospitals, thank you again, all of us. I know you guys are going through a lot of pressure, and you're doing all this for us. Again, thank you very much. We'll see you again next week, doctor. Thank you very much for doing this.
Bye bye.
Thank you, Dr. Prem.
Bye bye.
Thank you, doctor.
Bye. Thanks. God bless.